right, thank you, Todd. So my name is Adam Seal. I'm a postdoc. I'm actually Dr. Agobian's postdoc in the Center for Health Research, and we've worked on this project with Dr. Phelan quite a bit. And so let me share my screen, get this going. Sorry. All right, here we go. So for this study, we wanted to focus more on kind of the impact of the stay-at-home mandates that got put in place because of the pandemic, and how those stay-at-home mandates kind of affected health across the U.S. And specifically, you can see based on the title that we wanted to focus on weight gain. So just as kind of a virus timeline, just to kind of set the context of when mandates came into play and how it relates to our study. So the first US COVID case was in January 21st. And then we declared a public health emergency on February 3rd. And then the World Health Organization declared a pandemic on March 11th. And then March 19th, which is kind of where we start to think about our study, California became the first state to issue one of the stay-at-home mandates. And so just to continue that timeline out a little bit, we see California, like I said, on the 19th here. But what I wanted to show was that on around April 7th, most states, I think this is 43 here, so most of these states had implemented some sort of stay-at-home mandate by April 7th. And at this time, the US cases were just under 400,000 cases. But so focusing on our project some more. So what we wanted to, as I mentioned before, these stay-at-home mandates, we wanted to see how these changed in behavior. So what was kind of seen in previous literature is that there's been some changes in diet. So in this figure right here, we're just looking at the difference in relative frequency of use of these different products as compared quarantine versus pre-quarantine. So we can't really draw conclusions as far as weight gain with this, but what I just wanted to show with this is that there are changes occurring in the diet. And then we've also seen changes as far as physical activity, and this is best kind of overall shown with this figure from Fitbit. So this week number 10 right here is the start of lockdowns. You see a 12% decrease in step count according to Fitbit, their data, their publicly available data. And that's as compared to last year at the same time. So seeing a change in diet and decrease in physical activity. So some studies before ours started to look at some of these health effects as well. Two of these, one by Flanagan, also showed increased time of sedentary and decreased activity. And then in this study as well, they showed that people with obesity had the greatest declines in mental health and the most weight gain. This was a retrospective study, meaning they took measurements, so they sent a questionnaire and then asked the participants to compare it to their past before the pandemic. And then this study by Zachary et al. Showed 22% of people had weight gain of at least 5 pounds, which we consider pretty significant, especially during this short amount of time. And they also looked at some risk factors, and those included inadequate sleep, snacking after dinner, stress eating, and reduced physical activity. And this study was cross-sectional, meaning they just looked at one point of time across all their participants. So as I just alluded to, so these studies were retrospective and cross-sectional, and neither controlled for any socio-demographic factors in their analysis. So that brings us to our study that we conducted. So our primary aim was to longitudinally look at the effect of mandates specifically on body weight in US adults over 3 months. And then we had secondary aims to explore predictors and correlates of those weight change, which included demographics, physical activity, diet, stress, depressive symptoms, sleep, and COVID perceptions, just how people perceive the virus. So getting into our methods, pretty short and simple. It was a natural longitudinal design. Any adult aged over 18 years in the US. Our survey was 98 questions, and we repeated the survey after 3 months. So just to hit on that some more, so the study timeline, first COVID cases in January, lockdowns in March. We sent our first survey in May, and then in August, we followed up with our second survey. So we're really focusing on this time between May and August. And just real quick, the statistics that we used for change in body weight, we used a paired t-test and a chi-square. And then we also ran a multivariate regression to look at the predictors of those weight gains. And we split the variables into 4 domains, which will come into play as I talk about the results some more. So just to quickly go over our demographics, we had a total sample size of 1522. Pretty overwhelmingly female amount of respondents, and race was quite of 84% white, 76% Asian, 69% Black or African American, and 71% Hispanic or Latino. Household income, BMI category, and education were a little bit spread out more evenly in our population. So we kind of strive to do that a little more. We focused on recruiting to make these categories a little bit more even as far as sample size. All right, so getting into the actual results of our study. So the main figure right here, change in body weight just across all of our participants. So this is baseline. So again, that first month, and then after the 3 months, we saw a 0.6 kilogram increase in body weight. And this was statistically significant between or after 3 months. And 29.7% of our participants reported any weight gain at all. And then 18.4% of participants reported weight gain greater than 2 kilograms. So then we also looked at the percentage reporting weight gain, and we split that by BMI category, just to see which BMI category they've had the most trouble. So we saw that people with obesity, a higher percentage of them reported weight gain as compared to normal weight individuals. So this kind of hints that the lockdowns could have affected people with obesity quite a bit more as far as weight gain. And these numbers right here, I know there's a lot of numbers on here. I'll kind of walk us through it a little bit. But this is just change in some of the domains of the different variables that we included. So this is just straight t-tests. So depressive symptoms increased significantly. And again, this is not related to weight gain at all. But what's interesting about these depressive symptoms is that a score of 16 is, with the instrument we use, indicative of depression. So at baseline, we were already on average indicating depression, and then that increased. Stress actually decreased, but these numbers are actually higher than the normative values for the instrument that we used. And then physical activity decreased quite a bit, about 20 minutes per day, and then sleep actually decreased, and that was significant as well. But not to, like in all real aspects, that's only about 10 to 15 minutes, so not too important there. So the 4 domains that I mentioned earlier, so demographic, psychosocial, diet, and physical activity. So this is with our regression that I'm getting into now. So we saw that only mandate length was related to weight gain. And then for psychosocial, change in depressive symptoms, then also change in time spent preparing food, and then minutes of activity per day at baseline and the change were also related. So just to interpret that, give a little more context to what all that just meant. So longer mandates were associated with weight gain, worsening depressive symptoms, more time spent preparing food at home, lower baseline physical activity, and decreased physical activity all were associated with weight gain. So our 3-month weight gain was 0.6 kilograms. Other studies have shown annual weight gain of about 0.34 kilograms to 0.8 kilograms. So that's over the course of an entire year. And then also previous studies outside of the pandemic have shown holiday weight gain of only just under 0.4 kilograms. So what we've seen, take-home message, is atypical weight gain over the 3 months of mandates. It's disproportionately impacting individuals with obesity. Longer mandates were associated with weight gain, and then physical activity and depressive symptoms were also associated with weight gain. So I just want to note this study is ongoing and we'll continue to follow participants every 3 months for the next year. So we're excited to get to analyze those data and see how the mandates continue to, if at all, improve or what's going to happen. Quick thank you to all who helped with the project, and I'm happy to take some questions.
Thank you, Dr. Seal. A great presentation. So this paper is now open for questions or comments.
Hi, Adam. I have a question. What do you think that are your predictions for the 1-year follow-up? Do you think you'll continue seeing more depression, less physical activity?
Well, I certainly hope that it gets better, some of these numbers. But I would venture to say if we continues to start opening up and everything and things start to get back a little bit more to normal, that we might see some of these numbers, especially those depressive symptoms, start to go back down to normal level. But that all depends on what happens with the virus and if anything kicks back up again. So, yeah.
Thank you.
Thank you. Other questions or comments? We still have a couple minutes.
Okay, I have another question. I know your population was mainly female and white. Do you think it would look different in other, for males or for other ethnicities?
Certainly, yes, it could. I don't want to speculate as to what it could look like, but yeah, definitely. It was a convenient sample, so it's just whoever responded, that's what we got. But yeah, it certainly could be different. Yes.
Thank you.
We have time for one more quick question. Karina, did you have another one?
I'll let other people ask. I know where I can find Adam.
Other questions? So Adam, can you just make a quick comment on the weight again, the weight gain, the 0.6 kgs and how that's, is that a lot of weight or not? Just putting it in perspective over the course of those 3 months.
Yeah, so over those 3 months, like I said, so with, like I pointed in that last slide, typical holiday weight gain is only 0.35 kilograms. So that's during Christmas and Thanksgiving. So it's kind of, we showed weight gain that was kind of double that amount. And this was just because of the lockdowns. So pretty atypical as far as that goes. And then it was also comparable to annual weight gain. So giving that context, yeah, it's pretty significant weight gain.